Now the second tool we have is a sensory bite. So you can see here again is a mention here is a sensory bite. So sensory bite is very important to develop biting skills, which is a very difficult task for the child. So what is chewing could be easily able to develop with the help of this oral tube, but biting is the most difficult task, and generally in 90% of the kids having the issues with the biting things, especially when you're handling with the kids as well as when you're treating cases with the dysarthria or aphasia or in case of dysphagia. So this sensory bite is playing a very important role to develop the strength of the biting skills. So now what we have to do it, we have to just hold the sensory bite this way and you have to just put inside your mouth like this. And gradually you have to insert it. Now what happening exactly here? So due to the gravity, now here you should understand about basic physics, which is very important to understand about the principle of sensory bite and how it works. So basically sensory bite has a lot it contains a good strength to opening and closing of our jaw, especially with the frontal teeth with both upper and the lower. And then we use the sensory bite to develop the biting. So when we open our mouth, so due to gravity we should keep our mouth open and closed. Now what happened when you put in the sensory bite inside the mouth like this, due to gravity this is automatically opening. But when you feel get irritated and we want to close the mouth, we are just applying the different pressure. We call it as a centripetal force. We are going towards the center, and now there's the upper teeth would be the center and the lower tooth would be the centrifugal forces. So now you should understand about how this force are acting for our biting skills, and biting can happening automatically without any additional force like this. So this is the first thing which we do with this sensory bite. Second thing, we have so many blisters here. These blisters are very important because when you want to stimulate any nerve, we should understand about how to stimulate and how to improve the residual neural functioning. So with the help of these blisters, we can utilize this residual neural functioning and we can stimulate the sensory areas. What you have to do it, you have to just put this sensory bite inside your finger, just locked it like this, and then you have to put like this. So jaw की strength को develop करने के लिए भी हम sensory bite को use करते हैं इस तरीके से. Then we have a different blisters here to just give you a sensory feelings. So this is stimulator. So wherever when you want to stimulate this particular area, we have to just stimulate like this. Like this. The same way you have to do with the other side. For jaw strength, you can check with the jaw strength. For checking jaw strength, you have to use the sensory bite again, and then you have to ask the child to hold it, and you have to count numbers like 1 to 10 or 10 about from that. So you can go with the 1 to 10, then gradually you can increase the numbers, like you can go with the 1 to 10, 1 to 20, 20 to 30, 30 to 50, like that. You can go according to the child need, and then you can check the strength of the child also with this. So this is the things which we do with the sensory bite. Now the second thing, how we'll do it. So this is a little difficult task, but in case of flaccid dysarthria or spastic dysarthria, when we are handling with the child as well as with the childhood apraxic speech, childhood dysarthria, so in that case we can utilize this way. You have to put this upper groove and the lower groove this way. The same way we do with the other side. First put the lower portion and then upper portion. Like this way to utilize this. Now when you want to do with the symmetrical chewing. So you have to just put the sensory bite inside the mouth. You can see here, I can able to develop my biting, my chewing, my jaw strength, and everything, as well as I can able to stimulate the like my jaw muscles. So this is the very important for the development of this speech functions. We can say I can utilize this for stimulating with the tongue, jaw, and especially with the oral cavity. Like we do have many muscles. I'll explain you everything and I'll explain the other things. Which are the muscles of mastication and why these are the important. The muscles of mastications are important for development of your speech as well as the vegetative functions like chewing, biting, blowing, and sucking. So these oral sensory integration tools can help you to develop both vegetative as well as non-vegetative. Those are like speech functions. So this is the very important thing. Third thing we have is Hickey, which is very important for us. Like, when you want to develop this strength with the both external and the internal muscles, which are directly or indirectly responsible for development of speech. Like, this Hickey is a diamond shape. And why do we have a diamond shape? Because opening of mouth is very difficult, but with the help of this Hickey, we can develop this opening mouth very easily. What you have to do it, you have to hold this Hickey this way. In this Hickey, we have two sides. One is a plain, like which is a smooth one, and the another one we have a small blister. So we have two type of blisters here, a big blister and the small blisters. So these blisters can stimulate both external and the internal muscles of speech. Got it. So now what we have to do it, we just hold this way and you have to insert like this. You have to just apply little pressure in between your both upper and the lower teeth, and then you have to put inside like this. And at this fixed point, you have to just fix it. And this automatically will fix it, and then you can apply, you can do with other exercises, which is very important for the development. So you can just go with the cross way also. This way. This way. Now the development of jaw, like jaw strength, we can develop with this Hickey. What do you have to do it? We just vertically and the horizontally. So this is the vertical plane and this is the horizontal plane. So you have to just put the horizontally first. Like this. Like this, and then vertically like this. Now how to use this externally? So first you have to start with this small dots, which we'll call as small blisters. You have to just apply the pressure this side, and then you have to use like this. You have to apply the entire thing. You have to cover this. And then you have to stabilize with the softer part this way. Like this. So what we're doing it in case of hypersensitivity or hyposensitivity, in both cases, this is the very important to reduce or increase. So we can just stabilize with the normal sensitivity, and you have to utilize the Hickey in this way. Now externally also you have to use it the same way. First externally, from the softer side, harder side, and then softer side like this. Like this, over the tongue, below the tongue. Frenum is the most sensitive part, so you have to utilize this frenum also like this. So this way we can use this Hickey, and with all these three tools, you can see the drastic changes within a couple of weeks. So these are the very important. And if the child is having a lot of sensory issues, so this is just like it's kind of a pendant. You have to just put inside the and you just ask them to chew whenever they'll get like sensory issues and all. So they can use as a teether as well.